Okay, it's an honor to introduce Dr. Mohammed Jabr in this presentation. Okay, we are going to talk about mechanism and the clinical evidence and future direction of bacterial antibinding dressing. Advanced wound dressing aim to reduce bacterial attachment, bioburden, and biofilm. This is especially relevant in chronic wound, as we know. The main goal is to reduce infection risk while supporting wound healing. As we see in this diagram, 68% of chronic wound have a biofilm. This has an evidence from 2025 systematic review. The main organisms reported from these wounds are Staph aureus and Pseudomonas. This makes the antibiofilm and the antibinding dressing strategy clinically important. What does bacterial antibinding dressing mean? Antibinding usually refers to dressings that prevent bacterial adhesion. So it is not killing the bacteria, but the bacteria adhere to the hydrophobic dressing and decrease the bacterial bioburden. So it's an anti-adhesion, not a killing procedure. Main types of bacterial antibinding dressing: hydrophobic, and we may add silver, iodine-based, or some new in research techniques still. Mechanism of action: as I mentioned, bacteria first attach to the wound surface, then form a biofilm. Antibinding dressing aim to interrupt this early step. DAC technology, which dialkyl carbamoyl chloride, it's a hydrophobic interaction trapping microbes onto the dressing rather than releasing a chemical killer. Other advanced material work by resisting protein bacterial attachment, which reduce surface colonization. Clinical examples, as I mentioned, DAC-coated dressing are among the best known bacterial binding system. Their action is physical, not antibiotic-based, as I mentioned before. Clinical literature suggests benefit in reducing local bioburden, supporting healing, but overall evidence quality is still limited and not uniform across all types. Their main strength is reducing bacterial load without drug release. Now I give the chance to my colleague to continue presentation. Go ahead.
Thank you, Dr. Peter. Silver dressing are among the most widely used antimicrobial dressing in wound care. They act mainly by releasing silver ions. These ions damage bacterial cell and reduce bacterial burden. So, silver dressing are effective, but they are conceptually different from pure antibinding dressing. Their main mechanism are bacterial killing, not physical bacterial capture. Iodine-based dressing also play an important role in wound management. They help reduce exudate, slough, bioburden, and local infection. This improves wound bed preparation and may support healing. However, iodine works through antiseptic technique, so it's not considered as a pure antibinding strategy. Bacterial antibinding dressing offer several potential advantages. They reduce bacterial adhesion and surface colonization. They may reduce reliance on topical antimicrobial, and they may also help limit biofilm formation and support wound healing. However, the technology in literature sometimes inconsistent. Also, large high-quality clinical trials are still limited. Take-home message. In summary, bacterial antibinding dressing represent a promising strategy in modern wound care. Their key principle is to prevent bacterial attachment or physically remove bacteria before mature biofilm develops. They are most useful as a part of broader wound care plan that include debridement, moisture balance, and infection control. So, modern wound care is not only about killing bacteria, but also about preventing bacterial attachment and resistance. These are the main references used in preparation of this presentation. Thank you for your attention. We hope this presentation has provided a clear consensus overview about antibacterial binding dressing and role of wound care. Thank you.